Urinary system is a very small system made of two kidneys. They are bean-shaped organs that are located just above the waist. The kidneys are the ones that filter blood of waste and then excrete those wastes into a fluid called urine. So basically kidneys produce urine, and then urine from kidneys will be sent into ureters. We have two ureters. These are long tubes. And when we follow the ureters, we see that they take urine down eventually to release urine into the storage of urine, which is the urinary bladder. So urinary bladder is in charge of storing urine. It does not change the composition of urine. It just holds urine for several hours. And when the time comes for micturition reflex, urination reflex, then from urinary bladder, urine will be sent into this pathway, which is just one pathway named urethra. And as you see, urethra opens to the exterior. So basically the whole urinary system is made of two kidneys, two ureters, one urinary bladder, and one urethra. Kidneys are located, as I mentioned, just above the waist between peritoneum and the posterior wall of the abdomen. So kidneys are retroperitoneal organs. If we want to find the exact location of kidneys, they're located between the levels of thoracic vertebral bone number 12 and lumbar vertebral bone number 3. This is a position that allows kidneys to be partially protected by ribs number 11 and 12. Recall, ribs 11 and 12 are referred to as floating ribs. So this is the advantage, that kidneys are protected by those ribs, but there is also a disadvantage. The disadvantage is if those ribs are fractured, they can easily damage the kidneys, and that would be a life-threatening damage. The next thing is, in an adult, when we look at the shape and the size of a kidney, first of all, the kidney looks like a bean, and its length is about 10 to 12 centimeters. That equals 4 to 5 inches. The width of each kidney is around 5 to 7 centimeters. That's 2 to 3 inches. And the thickness of the kidney is about 3 centimeters. That equals 1 inch. And the weight of each kidney is around 135 to 150 grams. So in general, each kidney is almost about the size of a bar soap. Each kidney, as you can see, has a concavity. The concave border of the kidney faces the midline, faces the vertebral column. And exactly in this concave border of kidney, we find an indentation, a depression that is called renal hilum. And we pay attention that exactly in the renal hilum, ureter is attached to the kidney. And also we have blood vessels such as renal artery, renal vein, lymphatic vessels, and nerves. So that's the importance of the renal hilum. Around kidney, we have a dark brown capsule made of a strong connective tissue full of collagen. We call this the fibrous renal capsule. What it does, it protects kidneys against trauma, and also it helps kidneys to maintain their bean shape. One thing that is missing in this model would be that we also have a capsule around kidneys made of fat, adipose tissue. Clearly, having a capsule made of adipose tissue protects kidneys from trauma, and also it helps kidneys to stay in their place firmly. Please keep in mind that above kidneys, but tilting toward midline, we have the suprarenal glands that in separate videos we talk about them. But for now, we focus on what we find in a frontal section of kidney exactly below the fibrous renal capsule. So as soon as we cut the kidney through frontal section, we see that below the capsule, we have an area that has a lighter reddish color. We call that renal cortex. But the inner region of the kidney has a darker reddish brownish color. We call that renal medulla. And those anatomical structures that filter blood and produce urine are called nephrons. They are microscopic and we don't see them in this model. So in a separate video, I'm going to talk about nephrons. Before I move into ureters, it is important to note that this large blood vessel that we see here is abdominal aorta. And as you see, both renal arteries emerge from abdominal aorta. They send oxygenated blood into the kidneys. As I mentioned, the renal arteries enter kidneys in renal hilum. And then the nephrons that we don't see them in this model, but we know they are in the kidneys, filter blood and produce urine. And then they send back the substances that we need to keep back into blood. So the filtered clean blood eventually exit the kidney through renal veins. And as you see, renal veins send this blood to inferior vena cava, which takes blood to the right atrium of the heart. Exactly here, I can see one space that urine produced by all the nephrons that we have in kidney will be released in this one space. We call that renal pelvis. And as you see, from renal pelvis, urine goes into ureter. So now I follow ureters, which they are long pathways. Each ureter is about 25 to 30 centimeter long. That equals 10 to 12 inches. Ureters have very thick wall and they are very narrow tubes. And it's interesting that when we analyze the diameter of ureters, we notice that the diameter, depending on in which section of ureter we are, varies. Basically, the diameter of ureters from beginning to the end varies between 1 millimeter to 10 millimeter. And when I follow the ureters, I go down. I can see that here they are located posterior to gonadal blood vessels. Then when I continue, I see that they move anterior to common iliac vessels, internal iliac vessels, and eventually they get inside the pelvic cavity. Please note that ureters go behind urinary bladder, and exactly in these two openings that we refer to them as urethral openings, they release urine into the urinary bladder. At the openings, we do not have any anatomical valve, but we do have physiological valve. That simply means when the urinary bladder is filled with urine, the pressure inside the urinary bladder increases and it compresses the openings of ureters. These openings are located through an oblique pattern, and when they are compressed, they narrow down and slightly close. That prevents urine from urinary bladder going back up into ureters. However, it is important to note if you're experiencing any infection in the lower part of the urinary system, urethra, urinary bladder, those microorganisms can actually use openings, go through ureters, and eventually reach kidneys and cause infection in kidneys. That's why having a good hygiene in this area, and in case we end up with any urinary infection, taking care of it immediately by following a proper treatment plan is extremely important. As we see, urinary bladder, which is a muscular organ and sits inside pelvic cavity, has opening to ureters and also has opening to urethra. Please note in this model, that would be the urethra of a female. It's a very short urethra. We call the opening of urinary bladder into urethra internal urethral orifice. And when visually we connect the openings of ureters to internal urethral orifice, we have a triangular area in the lower part of the urinary bladder, which is called trigone. In the lining of urinary bladder, we see these elevations. We refer to them as rugae. Obviously, they help urinary bladder to expand from inside and open up the space and hold on to more urine. And also we know that in most of these urinary pathways, including urinary bladder, ureters, portions of urethra, we have transitional epithelium. Recall that transitional epithelium is the one that when more fluid is stored or passes through these pathways, some of its cuboidal cells are compressed and change into a flat cell and open up the space inside these hollow organs. So that's another thing that helps, for example, urinary bladder or ureters to be ready for a larger volume of urine. The next thing is in the wall of urinary bladder, we have 3 layers of smooth muscles. We refer to them as detrusor muscles. Clearly, we need detrusor muscles to be relaxed when the goal is to store urine, but when micturition reflex, urination reflex start, we need contraction of the detrusor muscles in order to push urine out from urinary bladder into urethra. So the parasympathetic axons that we find in the sacral spinal nerves are the ones that stimulate the detrusor muscles of urinary bladder during urination reflex. Then I follow exactly from urinary bladder what we have in the rest of the urinary system. So I focus on the urethra. We have internal urethral orifice. Also, we have external urethral orifice. External urethral orifice is the opening of urethra into the exterior. When I focus on the internal urethral orifice, I see that we have a group of circular smooth muscles around this orifice. That would be internal urethral sphincter. When we say internal urethral sphincter is made of smooth muscle, it simply means that autonomic nervous system is the one that controls opening or closing of this sphincter. However, when we move down a little bit, we can find another sphincter. That sphincter is made of skeletal muscles. That's external urethral sphincter. This is the one that we learn through training to control its contraction or relaxation and control the micturition reflex. So we have 2 urethral sphincter. Then we start focusing on differences between the urinary bladder and urethra of male versus female. Here we have a mid-sagittal view of female pelvic area. Recall that pubic symphysis, that's exactly the joint between the 2 hip bones, and as we see, the urinary bladder sits exactly behind the pubic symphysis, and that would be the urethra of female, which is just about 4 centimeters. Internal urethral orifice, external urethral orifice. And we note that the urinary bladder of female sits anterior to vagina and sits below uterus. So in a way we can say that the pelvic cavity is shared by uterus and urinary bladder. That explains whenever female experiences some sort of edema, inflammation in the uterus, which could happen during menstruation, for example, or during pregnancy, why uterus keep pushing urinary bladder, and then the feeling that urination is necessary is more frequent. And I would like you to pay attention to how much space we see inside the urinary bladder of a female. When I show you a male urinary bladder, you notice that considerably the space that we have inside the urinary bladder of a male is larger. But in general, we say that an adult urinary bladder has a capacity around 700 to 800 milliliter. However, in most cases, when the volume of urine inside the urinary bladder reaches, for example, 200 to 400 milliliter, that feeling that emptying the urinary bladder is necessary. And before I move on to a male pelvic region, I would like you to pay attention that the only fluid that passes through female urethra is urine. If we're talking about menstruation, obviously we know that menstrual flow occurs through vaginal canal, and this is rectum and anus, so that would be for eliminating the solid waste. This is the urinary bladder of a male. As you can see, it has a much larger space compared to a female urinary bladder. It sits behind the pubic symphysis and in front of rectum, and the urinary bladder here sits above a very important gland named prostate gland. Throughout life, enlargement of the prostate gland is going to happen, so that impacts how frequently urination should occur, and also that impacts the easiness of the urination in a male. Then I follow the urethra of the male, which is a long pathway about 20 centimeters. That's the internal urethral orifice, and here I have the external urethral orifice. because it's a very long pathway, we divide it into three parts. The beginning of male urethra passes through prostate gland, so we name this part prostatic urethra. Then we have a very small section of male urethra that is not inside prostate gland and is not inside penis. We call this small section membranous urethra or intermediate urethra. And the longest part of male urethra passes through penis. This part is called either spongy urethra or pineal urethra. So prostatic urethra, membranous urethra, and spongy urethra. Around the internal urethral orifice, we can find the sphincter made of smooth muscle, internal urethral sphincter. And if we're looking for external urethral sphincter, which is made of skeletal muscle, we find it somewhere here. And that explains when male is done with urination and consciously make the muscles of external urethral sphincter to contract and close the sphincter, why urination stops with a delay? Simply because the urine that is present in spongy urethra should be eliminated. So delay is completely normal. The next thing is that the urethra of a male is shared by two systems, urinary system and also genital system, reproductive system. So we use male urethra more frequently as a passage for urine. However, during ejaculation, we know that from basically the structures that we have inside the scrotum, we have movement of sperm up through some pathways that we don't really see them in this model. So in a separate video, I have to explain them. Through a long pathway named ductus deferens, the sperm eventually gets inside the prostatic urethra. Here we can see a little bit of a duct named ejaculatory duct. So from ductus deferens, sperm gets inside the ejaculatory duct, that empties sperm into prostatic urethra, and then sperm and semen continue going through membranous urethra and spongy urethra to exit. Since we use the male urethra for both sperm, semen, and urine, it is important to note that urine in most cases is acidic. Obviously, it depends on our diet, but in general, one of the important jobs of urinary system would be excreting the extra hydrogen ions. So urine is acidic, and sperm is a cell that is very sensitive to acidity. That explains why in semen we have to have a large volume of a buffer such as bicarbonate ion. And we do have several glands in male genital system that they produce a very large volume of bicarbonate ion. In short, those glands are seminal vesicles and also bulbourethral glands. Those are some of the male glands that produce the buffer to neutralize the pH inside the male urethra, and obviously later neutralize the pH inside the vaginal canal and cervical canal of a female, and allow sperms to survive and continue their journey to finally fertilize the egg cell. So this was a short summary of the major differences that we see in urinary bladder and urethra of a male versus a female.